Hello and welcome back to the Infection Control Training, Part 4, Management of Sharps. Sharp injuries amongst healthcare workers remains to be a serious problem. The majority of needle stick injuries takes place in the clinical setting. Worldwide, more than 100 healthcare workers have contracted HIV and thousands have contracted hepatitis B and hepatitis C. The term sharp is the general term used to describe needles and bladed devices, such as scalpels and razors. A sharps injury is an inoculation with an instrument, such as a needle or scalpel blade, contaminated with blood or any other body fluid. There are some general rules that we should follow to ensure that we are safe and that we do not sustain any needle stick injury. Do use an approved sharps container. We currently use sharps containers that are yellow with yellow lids. All syringes and needles should be disposed of as one unit and they should never be resheathed. All sharps should be disposed of immediately after use by the person who has used them. If you are involved in any community visits, then if no sharps bin is available on site, you must take a community sharps bin with you. Always keep sharps bins out of reach of children. Be aware of the actions you need to take following a needle stick injury. You should be able to find this information in your local policy. Those that are involved in the assembling and locking of all sharps bins must sign and date them. Remember, do not resheath needles. Do not overfill the sharps bins. There is a black line indicating the level in which it can be filled, which is about 2/3 the content of the box. If the bin becomes overfilled, do not decant into another bin. Just lock it as quickly as you can. Never place bins into a clinical waste sack, and never leave sharps bins in cars overnight. Never place sharps bins below waist height or above shoulder height. Here's a reminder of some of the good practice that we should be following in terms of management and disposal of sharps, and also some of the poor practice that we shouldn't be doing. The less that we handle sharps, the decrease in the risk of sustaining a needle stick injury. If you should sustain a needle stick injury, then you should follow your local policy, but here are a few general guidelines. Allow the wound to bleed and then wash it under running warm water. Cover the wound with a waterproof dressing. If you have any materials that have gone into the eyes or the mouth, rinse them with running water. You should report the incident immediately, and you should attend your designated centre in case you require any prophylactic treatment. Here's a checklist that you can use. In some cases, it may be necessary to conduct a risk assessment of the source of the person. All staff dealing directly with body fluids should be immunised against hepatitis B virus. You should know your hepatitis B status after completion of the full course. Remember, levels of antibodies fall after a period of approximately 5 years. Therefore, after this period, it may be necessary to have a blood test done to maintain sufficient levels of antibodies.